in Ohio, and I wanted to talk a little bit about the coronavirus. I hear
Mhm.
your show a lot, but not everything you say, of course.
You're a physician. You're a
Couple
physician,
of
correct?
things. I am,
Okay.
correct, yep.
Okay.
There is a tremendous amount of collateral effects from this in our area. The United States, the world. For example, we've ordered masks, which are going to be hard to find. We only get 80% of our last order, and that will probably continue to decrease. 30% of the people in China who were infected were healthcare workers in the hospital. And, if you don't have that line of treatment available and those people available, it's going to be hard to take care of these kind of patients. It's definitely a casual contact type of infection. There are two parts of it. There, for many people, are an initial illness. It's very much like a cold, and then if you are going to get in trouble, it's the next week, so it's more prolonged than the typical influenza. We need things like the N95 masks, eye protection, gowns, gloves, et cetera, to be able to take care of the flu patients, as well as, of course, to try to, if possible, contain, this newer virus. When you had said in the past, I'd heard you say that the mortality rate for the flu was higher than for the coronavirus, and actually that's not correct.
Yeah, we heard that
And
today, that it's
said
not.
it later that it wasn't. Yeah,
Yeah.
It's about 2%.
One of the things we've mentioned is that the flu rate has been higher in the past. Like the Spanish flu mortality rate was 20%. And the flu rate right now, I don't know I think it's a little under 1%, but so many more people get the flu here in America than that have gotten the coronavirus worldwide. There's no comparison there. You can't compare that. Because so far in America, the mortality rate is 0. Nobody has died here from it. And, that might not always be the case, but I certainly hope it is. Anyway, you had some other figures that you wanted to share with us? Julie?
Well, mortality for flu is 0.1%.
0.1,
Last year we had, I believe we had 150,000 deaths with the flu. And that also includes, by the way, when we say the flu, it's actually flu-like illness. So not everyone who has the flu is diagnosed with the nasal swab PCR test. When we're in the middle of an epidemic, then we call it flu-like illness. And a lot of people are treated as though they had the flu. They may or may not have had it. We're very early in this particular condition. Really December, probably, and maybe earlier, depending on on China's information. But it's much more contagious than the flu, is the current feeling. It's a very small virus, so the loop masks, the ones that are more flexible, you see people wearing, are really not adequate protection. And it's not that we're telling people to go out and get the harder N95 masks that we use in the hospital, but those loop masks will not protect you from it. A lot of times what happens with both the flu and this virus is what's happening is you get it on the front of the mask. You're taking your mask off with your hand. You're touching your hand after you take your mask off to your face, your eyes, or whatever. And that's the entry point for viruses. So I really do believe we're in the beginning of this event.
So you think it's going to be bad here?
I do. I think there's going to be a lot of infected people. I don't think the mortality rate is going to change necessarily, but there will be a lot of people stuck in certain places, nursing homes, prisons, hospitals, dialysis centers. What happens if it's in a dialysis center? They don't have the means to isolate people. So I guess my point in calling was to say there's a lot of collateral effects of this type of a thing, particularly because for many people, when they are sick, it's a very prolonged event. The most recent, from what I've very briefly read about in Los Angeles, was a patient that they don't have any identifiable contacts with the questions we typically ask. Were you in China? Have you been near anyone from endemic areas? And this patient, was admitted with well into the disease on a ventilator with a positive test. And there's a lot of looking around for who that person could have been in contact with. So that's how it's going to become a community issue. And it's not going to be over in a couple of months. It's probably going to be one of those global things that returns and recurs. And it's not that we won't eventually have treatment. Coronavirus, we don't necessarily keep an immunity to. It's not a one-time disease like chickenpox, for example, or measles. So we'll be dealing with it for a very long time, and we are starting to see shortages. And the CDC's recommendation is hospitals and health centers start preserving or finding ways to not waste our materials, masks in particular. So, yeah, I do think it's going to be a big deal. It's going to be a big change. I think it may also be one of those things that sort of, at least temporarily, maybe permanently, will revolutionize some ways of taking care of patients. There'll be more telemedicine. There'll be more contact when you come into a hospital, for example, to decide what part of the facility you're going to go to before you're evaluated, so that we don't risk giving it to vulnerable people. So I'd definitely pay attention to this and see that in the next month we're gonna see a lot of ramifications.
Yeah, absolutely. It should be paid attention. I'm just saying we shouldn't be panicking right now. We shouldn't be shutting down
I don't think the public
our society right now.
But I think that I agree. But I think that the medical people definitely have to have in place plans to how to deal with shortages, medication shortages, because so many of our medications come from China or compounded in China. As I said, there's a global need for masks, and you're going to start seeing less of those. And if your healthcare workers get sick, they're not out for 3 days.
Yeah.
I mean, we work with the flu. You're not going to be out for 3 days if you get this, especially if you get into the second phase of it, where you become quite ill.
The spread of this, though, Julie, do you have to touch the person that is infected in order to get the disease yourself, or is it airborne?
It is considered airborne. Now, this is one of the problems. The CDC is just now growing it. When you hear about all this information we have information about its spread by what's called the PCR, which is the swab test you have for the flu. You look at the DNA of what's on the swab. That's how we know if it's coronavirus. And there's only 5 labs in the United States that even can test for it that are CDC labs. So there's a delay. There's a 3 or 4 day delay to get that material down to the CDC or to one of the labs and get that information back. So number one, it is felt to be airborne. They're growing it now. They're going to have more information as they see its behavior. It can live on surfaces for days, and that's typical of that type of virus, that coronavirus. So it's not just being in the room with the person, which is why it really is casual contact. There's no treatment for it right now. There's meds in the pipeline that they're testing, and there's certainly, of course, no vaccine at this point.
But if you're breathing the same air as a person who's infected, can you get it from that? You can.
They recommend that you need to be 6 feet away from someone who has it.
Okay.
And again, casual contact. Now, that person who's carrying that virus, this is true of the flu as well, but the person can be absolutely asymptomatic for a couple of days and shed that virus.
Oh, boy.
Or they could just have a cold. And in many people, and this is probably what's happening, there are so many people that have mild disease, which is why when you look at the Chinese numbers of 70-some thousand, there are no doubt thousands and thousands of people who aren't particularly ill with it, but who are spreaders of the disease. And as much as you'd like to say, boy, China has screwed this up or whatever, they have to be overwhelmed. I cannot imagine working in a hospital or a healthcare clinic. They don't have enough reagent to test everybody, and they're no longer testing all of these people with the PCR. They're doing X-rays or going by their clinical evaluation to see if they have it. And they're still trying containment. And that's what all these countries are doing, including the United States.
So, Julie, you made reference to a drug in the pipeline. I've heard of this drug. I heard that they were trying to rush it through. It would take about a year. Now I've heard they might get it out within 6 months. That would be a miracle.
I believe they're starting clinical trials. Yeah.
Okay.
They're starting clinical trials now.
So this virus has spread. We've known about it for 2 months. I mean, what does it look like in your professional opinion? Still 6 months out from possibly having this drug available. I mean, we're talking like August, right?
Well, remember, almost everybody recovers.
Okay.
So the drug is the drug important? Sure. I don't know which group they're going to test it on. Is it going to be the people who are on ventilators and are desperately ill?
Yeah.
And is that really fair to say, boy, they were on their way out anyway, unfortunately, and this drug didn't have an effect? I don't know that information, of course.
Gotcha.
But most people probably won't need to be treated, would be my guess.
Okay.
And maybe just if you're hospitalized, you would have to be treated. But there is not enough capacity right now, especially during flu season. In hospitals, they're already close to capacity. And again, you're looking at nursing care, the people that support the patients in the hospital not getting this. That has got to be the focus. A focus of this is to protect your healthcare workers. It sounds Like I'm exaggerating, but it really is really is a big deal. Nurses and other people taking care of patients are really freaked out by this, and they need to know from their hospitals and their bosses. Yeah, we got you. Everybody has an N95 mask. Everybody has eye protection. You're not going to know that person has that for days after you're taking care of them, and that's a problem.
Yeah.
And if you have it in a hospital, you're likely to spread that to many people before you know that you should be thinking about it. So that's, to me, the biggest issue in the United States.
But again, the mortality rate, the mortality rate with corona
is probably about 2%.
2%.
Yeah.
Okay.
Now that's in other countries. I mean, we have excellent medical care here, and that's
right. Well, it's just below Cuba and Uganda, but I mean, it's all we've got. So what are you going to do?
I'm not trying to make people fearful, but I want to be sure if
well, yeah, I'm right. Yes. Appreciate it. Thanks a lot, Julie. Yeah, I was saying earlier today that, while I don't think we should be panicking right now, since 60 people out of 330 million have it, it could become a serious issue here. And it should be taken seriously, and we should be taking precautions. I just don't think that the stock market should be tanking right now, and that we need to be in panic mode and clear out all the store shelves with supplies.